Hello everyone, it's Dr. Tom Chaney here from Living Health Integrated Medicine in Annapolis, back with another video. In this video I have an exciting announcement, and this has been something that has been years in the making. Super excited to share this with you. As many of you know, we help a lot of diabetics in our practice. We're very passionate with helping patients improve their health naturally, and diabetes is one of the things that we've helped thousands of patients with. We wrote Defeat Diabetes back in 2012, my wife and I. We wanted to put some effective strategies together that we've seen to be a tool to help patients. So we published this book back in 2012. But one of the questions we get from many of our diabetics, prospective diabetics, and other patients is, do you have any research with regards to the effectiveness of your diabetes reversal program and the effectiveness of what you do with the personalized functional medicine in general? So I have some exciting news that we have a research paper that's going to be published in the next coming months. It's been accepted into the Alternative Therapies in Health and Medicine. So this is a peer-reviewed journal. We're very excited that we got this accepted. And the abstract is available now. The hard copy, like I said, will be coming out in the next couple months. But I wanted to share this with you. This is the abstract that can be found on PubMed. So if you just go to pubmed.gov, you type in my name, this will come up. I'll also put this link in the description down below. But this was a paper that we've been working on for a while, and the title of the article, the research, is The Use of Personalized Functional Medicine in the Management of Type 2 Diabetes, Single Center Retrospective Interventional Pre-Post Study. So let's go over some of the details of this research. So what we did was we looked through our files and we randomly selected 35 patients. Out of those 35 patients, we're able to get written consent from 11 of them to actually use their data in this research. There were 5 women, 6 men, from 50 to 77. Each of them were taking diabetic medication. Each of them were not happy with their recovery and had either reached a plateau or had seen their health start declining. They all wanted to reduce medication intake. They were all seeing their allopathic traditional physicians, whether that was an endocrinologist or a primary care doctor. And so what we did was we did a thorough intake, a history, just got all the data about what they had tried in the past, where they were at with their disease process, and then we started to order tests to help us determine how to put together a personalized functional medicine and diabetes reversal program for them. One of the things that we do differently in functional medicine in our diabetes reversal program is we tailor and customize the plan specifically for the patient. We don't have a one-size-fits-all, so there are certain nutrient deficiencies that one patient will have that maybe another will not have. Maybe one patient has hormonal imbalances that need to be addressed that another one does not have. So what we did was we assessed each individual and we determined what the issues were, and that allowed us to personalize the plan specifically for them and then start to implement the different phases of that program and walk them through that program, retesting at the appropriate times, and then looking at how we're doing as far as the results. So treatment lasted anywhere from 2 to 10 months depending on the patient's goals. And then what we did was the effectiveness was measured by the reduction of medication and also in the improvement of the type 2 diabetic markers like glucose and the A1C. And what we saw were the results showed that 6 patients were completely off type 2 diabetic medications. 5 of them had their reduction of 50% in their diabetic medication. We saw on average glucose decrease by 73.36 and hemoglobin A1C lowered by an average of 2.71%. So some amazing results, and these are the results that we see every day in our practice, but we thought it was important that we want to share this and publish this for other providers, number one, but also for the public, so they understand that what we do, it gets results, and it's a valid alternative to traditional care. So if you're you're out there and you're wondering, is there another approach to type 2 diabetes that is not just going to, manage this, but actually can possibly reverse it and give you your health back, improve your health. You start to see these improvements, and we've seen some amazing improvements. Patients coming off insulin, patients just really getting their life back that were worried about kidney failure, or they were worried about amputations, and just lowering your risk of all the complications that come along with the progression of this disease. So this is very exciting for us. I wanted to share this with you. Once again, it's the use of personalized functional medicine in the management of type 2 diabetes. And like I said, I'm going to put this link in the video down below, and you'll be able to access it. And then once I get the full copy, I will share that with you guys as well. I'll see you in the next video.